Hey guys, Dr. Mike Seibert with Whitefish Chiropractic. I want to talk to you guys today about a condition called subacromial impingement, or more commonly referred to as anterior shoulder impingement. This is going to be a condition where patients get pain with movement of the arm, specifically overhead movements, or reaching behind. Oftentimes you reach back there for a bra strap or something along those lines. That type of position is going to increase the ability for the body to impinge the tendon between the humeral head and the clavicle. It's really going to be position dependent for most people, and it almost always is coupled with something we call scapular dyskinesis. That's basically a fancy word for saying your shoulder blade doesn't move on your back the way that we want it to. A lot of times a patient will have a shoulder blade that wants to kind of wing forward, the shoulders drip forward into that position. A lot of us are kind of in this technology world where we're always having this sort of concavity in our chest, our head drifting out into a separate zip code. So those things are going to be contributing factors in that shoulder impingement. So we're going to want to try to identify whether you have scapular dyskinesis and then give you some exercises in order to help correct that. So the first thing we're going to do is watch the way your shoulder blade moves on your back, moving your arm up above your head and back down again to make sure that that's indeed moving correctly. If it isn't, again, that increases our likelihood of having some impingement here. We also want to rule out any chance of having a rotator cuff strain or rotator cuff tear. So we're going to check some strength in the shoulders to make sure that we're ruling out those big bad uglies and ruling in this impingement that's very, very treatable. As far as treatment itself is concerned, we're going to use a couple of different techniques. Again, starting with active release technique. An active release technique is a soft tissue technique, which is sort of a functional massage. We're going to be using pressure from the doctor while the patient goes through specific ranges of motion in order to break down tension within the muscle and tendon. We can also utilize Graston technique. This is a metal instrument with a beveled edge that we use to scrape across that tissue. Again, whenever a body has been subjected to inflammation, the reaction to that is to lay down scar tissue, and we want to make sure that we're mitigating that scar tissue to increase good blood flow and full range of motion. Lastly, we can utilize dry needling as well. The nice thing about dry needling is, as I mentioned, that tendon sits between the clavicle on the roof of your shoulder and the humeral head underneath. And for us to be able to contact that is impossible with our fingertips. But with a needle, we can insert that all the way through in order to get right into the tendon itself. So again, a very effective technique for helping increase targeted inflammation and break down tension within the muscle. As far as exercises are concerned, as I mentioned, it's always this condition always goes with scapular dyskinesis, or an inability to control your shoulder blade correctly. So the exercises that we're going to utilize in the office and at home are going to be targeted toward helping you stabilize your scapulae on your back. The humeral head sits on the scapula, so if the scapula isn't functioning correctly, the humeral head is going to be in a poor position. Again, typically forward, which is going to increase the amount of impingement. So we're going to try to utilize positions that will bring those shoulder blades back and down. One of our favorite exercises for that is called YTWL. And so you're going to start with your arms in this giant Y position. Think about pulling your shoulder blades together in the back and then keeping them there as you go from a Y to a T. Bend the elbows till you look like a big W, and then all the way down to this double L position. So what that's going to do is help you strengthen your scapulae so they make a better foundation for your shoulder to move from. If you think you might be having shoulder impingement, if you're getting pain with overhead movements or extension of the shoulder, pain in the front part of the shoulder, maybe radiating down into the deltoid a little bit, give us a call at Whitefish Chiropractic. We can definitely help.